Day from my diary. I love my job, but some patients can really test my patience. The food smuggler. The food smuggler. This patient should probably consider joining the cast of a spy thriller because they take covert snack consumption to a whole new level. They're supposed to be on a strict diet, and yet every time I walk into their room, it's like a little piece of a drive-thru has followed me in. First, it'll start subtly, with an innocent look and an empty nightstand. But then, I get that unmistakable whiff of fast food. Greasy, savory, totally not on their menu. That's when I know the game is afoot. A little investigating, and surprise. There's a burger wrapper half hidden under the pillow or a candy bar wedged in the nightstand drawer. These patients think they're sneaky, waiting for that precise moment I leave to break out their emergency snack stash. And while I don't mind the occasional slip-up, the food smuggler makes it a full-time job. They don't realize that all the sugar and grease they're smuggling in is setting back their recovery faster than you can say cholesterol. Sure, it's frustrating. I want them to get better, but their triple cheeseburger habit isn't exactly a prescription for health. At this point, I keep a close eye on their blood sugar, and they keep me guessing what today's forbidden fruit might be. Just a typical day in the life of a nurse with a sixth sense for secret snacks. This is a day from my diary. I love my job. Some patients can really test my patience. The mobile addict. What's yes, the mobile addict. The patient for whom the phone is nothing short of life support. You're midway through checking vitals, and they're deeply engrossed. Fingers flying across the screen like it's a life or death texting championship. You could be talking about anything, their heart rate, the weather, the meaning of life, and all you'd get is a vague nod and a as they scroll. Suggest putting the phone down? Brace yourself. The response is a gasp, a look of pure horror, as if you've requested they sacrifice their favorite pet or delete all social media. One sec, they insist, eyes glued to the screen, as if wrapping up that text or watching a viral video holds the secret to their recovery. And if you're really lucky, you'll get an irritated sigh if you dare interrupt their YouTube marathon to check their IV. You wonder if maybe the bed should be for the phone and the patient could just sit nearby. But no, you stand there with a professional smile, knowing that some battles, like prying that phone away, are better left unwaged. After all, in a hospital, the only thing more powerful than antibiotics might just be a full battery. Day from my diary. I love my job, but some patients can really test my patience. The mute. The legendary silent treatment. The mute is that patient who believes in the economy of language. Every question I ask is met with a yes, no, or if it's a special day, a mysterious maybe. Assessing them? It's like playing charades with someone who's decided they're in a witness protection program. Can you describe your pain? I ask, hoping for a bit of clarity, or at least a full sentence. But no. What I usually get is a raised eyebrow, or maybe a thoughtful nod, as if that's supposed to answer the question entirely. Sometimes I daydream about handing them a survey with multiple choice questions, just to see if it would spark any conversation. I mean, don't get me wrong, I'm all for respecting people's quiet nature. Silence is golden, right? But in nursing, clear communication isn't just nice, it's vital. Trying to treat them feels like solving a riddle with absolutely no clues, like I'm supposed to conjure Sherlock Holmes-level deduction skills just to figure out if they've got a headache or a broken heart. Honestly, sometimes I wonder if they're hiding state secrets, guarding their symptoms as though telling me might put national security at risk. So there I am, in full detective mode, scouring for clues in their expressions, gestures, and occasionally, their sighs. The mute may be a person of few words, but for me, they're the word puzzle I never signed up for. Day from my nursing diary. I'm a nurse, and I love my job. Some patients can really test my patience. The late night chatter. Meet the patient who, as soon as the clock strikes midnight, finds their inner night owl and sudden urge for a deep heart-to-heart. By day, they're quiet as a mouse, but come nighttime, they're ready for a one-person talk show. Midnight is apparently the perfect time to dive into every topic under the sun, and maybe even the secrets of the universe. It starts off innocently enough. So, how long have you been a nurse? Then, before you know it, they're recounting high school romances, the drama of their last family reunion, their pet's complex personality, or their thoughts on aliens and global conspiracies. You try to nod and listen, inching toward the door, your mental escape route fully mapped out. Meanwhile, you're balancing other patients who either need serious medical attention or, unlike your chatty friend here, are blissfully asleep. You remind yourself they probably just need someone to talk to, and a small part of you feels guilty. But after hearing about their cousin's second wedding and their theory about déjà vu, you start praying they'd just take a little hint. It's 3 a.m. after all, and you're on the final stretch of a long shift. Wouldn't it be nice if they saved these midnight musings for, say, lunchtime? Day from my diary. I love my job, but some patients can really test my patience. The no needle please patient. Look, I get it. Needles aren't everyone's idea of a fun time. But the no needle please patient cranks up the fear factor to a level that can only be described as next level theater. For them, the mere sight of a syringe is enough to induce a full body shutdown. I'll be prepping a simple injection, and suddenly the questions start flying at me like we're in a courtroom drama. Is there any other way? Are you sure this is necessary? They'll ask, eyes wide as saucers, gripping the edge of the chair as if it's about to sprout legs and bolt. Then comes the breathing. Deep, exaggerated breaths like they're in a Lamaze class, preparing to deliver anything but calmness. I've had patients who attempt to talk themselves through it out loud, repeating, I can do this, like a mantra. And every once in a while, there's the serenader. Yes, the ones who start humming or even singing to distract themselves from the incoming jab. One actually launched into Twinkle, Twinkle, Little Star, as if it might lull the syringe into mercy. Of course, I do my best to reassure them with my calm, seasoned nurse tone. But in the end, there's no magic wand here. Sometimes you just need the needle. So I take a deep breath, channel all my patience, and aim for the cleanest, quickest shot, hoping to avoid a second attempt at all costs. This is a day from my diary. I love my job, but some patients can really test my patience. The rule breaker. The rule breaker. Every hospital has one. To them, every policy is more of a friendly suggestion than an actual rule. Dietary restrictions? They laugh. You can practically smell the contraband burgers and fries wafting from their room as they sip on a smuggled milkshake. Movement restrictions? Please. They're practically doing laps around the ward, cheerfully dodging nurses with a wink and a just stretching my legs. You tell them they need to stay put, and they flash you a grin that says, rules? What rules? Their defiance isn't mean-spirited, just boundless. They view medical boundaries like they view traffic lights, mere decorations. You can explain the restrictions a dozen times in every gentle or stern tone in your arsenal, but they're convinced these guidelines are for other, more fragile patients. It's hard not to admire their sheer confidence. I mean, who else believes they know better than every healthcare professional in the building? Of course, while you're marveling at their audacity, there's a small part of you praying they don't end up in the ER after their latest adventure, because deep down, even though they're the ultimate headache, they're also the story you'll be telling your coworkers at lunch for the next week. This is a day from my diary. I love my job, but some patients can really test my patience. The can I get a second opinion? Patient. Behold the second opinion specialist. This is the patient who seems to question everything. Everything. From the accuracy of the clock on the wall to the quality of the air in the room, there is no detail too small. When it comes to their treatment, it's like talking through a live, ongoing pop quiz. I can spend 5 minutes outlining their medication plan, the timing, the side effects, the science behind it, only for them to stop, look at me, and say, do you think your supervisor would say the same thing? One time, after a rather detailed rundown on a treatment, they hit me with, maybe we should ask someone else if this is right. I tried so hard not to laugh, picturing myself paging a higher up just to repeat what I'd already explained. Then there was that moment, classic second opinion specialist, where I explained a simple procedure 3 different ways, and they still said, you know, I'd feel better if I could hear it from another doctor just in case. I get it, of course. It's every patient's right to ask questions, and it's important that they feel confident in their care. But with this patient, asking questions is more like an extreme sport. Now I just smile, brace myself, and wait for it. Can I get a second opinion on that? 9. This is a day from my diary. I love my job, but some